In this video, we'll discuss about rheumatoid arthritis. Arth refer to joint, itis refer to inflammation. It means inflammation in joints. Then rheumatoid means musculoskeletal illness. It affects together muscle and skeleton. So rheumatoid arthritis is a chronic inflammatory disorder that mostly affected the joints but can also involve other organ systems like skin and lungs as well. So this one mainly affected joints. It also affected skin and lungs also. So a healthy joint, this one is the healthy joints, has two bones covered with articular cartilage. This region, this one name is called as covered with articular cartilage at that end. Articular cartilage is a type of connective tissue. It is a type of connective tissue that acts like a protective cushion. It acts as a protective cushion is lubricate surface a bone to smoothing glide against. So it acts as a protective cushion, a lubricated surface for bone to glide against. One type of joint like the key joint is called synovial joint. So this one, this connective joint, this name is called as, the green color one name is called as synovial joint. Yes, synovial joint connect two bones with a fibrous joint capsule. So with the help of fibrous joint tubules, it can connected. So this synovial joint connect two bones with a fibrous joint capsules that is continuous with the periosteum with outer layer of both bones. Outer layer of both bones. This one is the outer layer. The fibrous capsule is lined with a synovial membrane that has cell that produced synovial fluid. This one has that cell, it having synovial fluid and remove debris. The synovial fluid is a normally a viscous fluid like a jelly like part of a chicken embryo and help lubricate the joint. The synovial fluid like a jelly or part of chicken embryo egg like that material help for lubrication of the joint. To help serve these synovial cells, the synovial membrane also has blood vessels and together the synovial membrane and the articular cartilage from the inner lining of the joint. So synovial membrane also has blood vessels and lymphatic blood vessels and lymphatics. Together the synovial membrane and that articular cartilage form the inner lining of that joint face. Rheumatoid arthritis is an autoimmune process that is typically triggered by interaction between genetic factors and environmental factor. For example, a person with a certain gene for an immune protein like human leukocytes antigen HLA DR1 and HLA DR4 might develop rheumatoid arthritis after getting exposed to some things in the environment like cigarette smoke or specific pathogen like bacteria that lives in the intestine. These environmental factor can causes notification of our antigen such as IgG antibody or other protein like type 2 collagens. So these two things, genetic factor because of human leukocytes antigen HLA DR1 and 4, because of environmental factors cigarette smoking pathogen like bacteria. These environmental factor can causes modification of our antigen such as immunoglobulin G antibodies and other protein like type 2 collagens or vimetidine. Type 1 collagen and vimetidine can get modified through a process called citrullination. So type 2 collagen and vimetidine can get modified through a process name is called as citrullination. That is when the amino acid arginine found in this protein is converted into another amino acid citrulline. Meanwhile, due to the susceptibility gene HLA-DR1 and HLA-DR4, immune cells sometimes are not clever enough, so they get confused by the changes and they no longer recognize the proteins as self antigen. This antigen get packed up by antigen presenting cells and get carried to the lymph nodes to activate CD4 cell T helper cell. So this one is the lymph nodes. Here it will activate CD4 T helper cells. The T helper cells stimulate B cell to start proliferating and differentiate into plasma cells, which produce specific autoantibody against this self antigen. In rheumatoid arthritis, T helper cell and antibodies enter circulation and reach to the joints. Once the T cell secrete cytokine. So here inside the T cells secreted cytokines like interferon gamma and interferon 17 to recruit more inflammatory cells like macrophages to the joint surface. So rheumatoid arthritis, T helper cell and antibody enter circulation and reach joints. Once there, the T cell secreted, when it will reach, it will secreted cytokines like interferon gamma, interferon 17 to recruit more inflammatory cell like macrophages and macrophages into the joint space. These macrophages will also produce the inflammatory cytokines like tumor necrosis factor or T cell, this tumor necrosis factor or TNF alpha, tumor necrosis factor alpha, interleukin 1, interleukin 6, which together with the T cell cytokines and stimulate synovial cells to proliferate. The increases in synovial cells and immune cell create a pannus, which is a thick swollen synovial membrane with granulation or scar tissue. Scar tissue made up of fibroblast, myofibroblast and inflammatory cells. So this pannus, which is a thick swollen synovial membrane with granulation or scar tissue made up of fibroblast, myofibroblast, and inflammatory cell. Over time, these pannus can damage cartilage and other soft tissue and also erode bone. So, what are the damage? It causes cartilage and soft tissue and also erode bone. Activated synovial cell also secrete protease which break down that protein in the articular cartilage. Here protein is present and no, this one breakdown, and that articular cartilage having protein breakdown will happen here. This one is the now affected bone. Without the productive cartilage, the underlying bone are exposed and can directly rub against one another. In addition, inflammatory cytokine increase a protein on the surface of T cell known as RANKL or receptor activator of nuclear factor kappa B ligand. Rank L allow the T cell bind with rank, a protein on the surface of osteoclast, to get them to start breaking down bone. Meanwhile, antibody also enter the joint space. One antibody is called rheumatoid factor or RF, which is an IgM antibody that target that constant Fc domain of altered IgG antibody. So here it will binding process will occur IgG antibodies. Another antibody is anticyclic citrullinated peptide antibody CCP. Which target citrullinated protein. When these antibodies bind to the target, now binding process will occur, they form immune complexes. Here they will form immune complexes which accumulated in that synovial fluid. So these things will accumulated into the synovial fluid. There they activate the complement system, a family of 9 small protein that work in enzymatic cascade to promote joint inflammation and injury. Finally, the chronic inflammation causes angiogenesis. It causes angiogenesis or the formation of new blood vessels around the joint, which allows even more inflammatory cells to arrive. So finally, the chronic inflammation causes angiogenesis or the formation of new blood vessels around the joints. So which allow even more inflammatory cell to arrive. As the disease progresses, multiple joints on both sides of that body get inflamed and gradually destroyed. But this inflammatory cytokine do not just stay within that tight joint space. Instead, they escape through the blood stream and reach multiple organ system, causing extra articular problem, meaning problem beyond the joint space. For example, interleukin 1 or 6 travel to brain, where they act as pyrogens inducing fever. So this interleukin 1 or 6 can travel to brain where they act as a pyrogen inducing fever. In skeletal muscles, They promote protein breakdown and in the skin as well as many visceral organ. They leads to the formation of rheumatoid nodules. This one is the nodules of the surface of that body, which are round shaped collection. This one is the round shaped collection of macrophages. Okay, collection of macrophages and lymphocytes with a center area necrosis. Center area having necrosis or tissue death. Blood vessels can also be affected. Their wall get inflamed, resulting in various form of vasculitis and make them prone to developed arthro developed into arthromatous or fibrofatty plaque. It forms fibrofatty plaque. Blood vessels inflamed, resulting various of vasculitis developing. Here vasculitis, this one here development. This name is called as arthromatous or fibrofatty plaque. In response to inflammatory cytokine, the liver also start producing high amount of hepcidin. So liver also affected. A protein that decreases serum iron level. So it decreases serum iron level by inhibiting its absorption by the gut and trapping it into macrophages or liver cell. Meanwhile, within the lungs interstitium, fibroblasts get activate and proliferate, causing fibrotic or scar tissue that make it harder for that alveolar gas exchange. Also, that pleural and it can sometimes mess with lungs expansion. Lungs expansion. Rheumatoid arthritis typically involves multiple joints, usually 5 or more. Then symmetrically, meaning the same joint group of both sides of that body, like both hand for instance. Commonly affected joints are small joints like metacarpophalangeal and proximal interphalangeal joints of that hand and metatarsophalangeal joints of that feet. As a disease version, as the disease worsens, it can start to affect large joints like the shoulder, elbows, knee, and ankles. During flares or sudden worsening of the disease, the affected joint get extremely swollen, warm, red, and painful. Over time, they become stiff, especially in the morning or after being inactive for a prolonged period of time. People with rheumatoid arthritis may develop specific deformities. What are the deformities? Ulnar deviation, then swan neck deformities, then cutaneous or buttonhole deformities. These are the different type of deformities will occur. Extra articular manifestation include non-specific symptoms of inflammation such as fever, low appetite, malaise, and muscle weakness. And organ-specific manifestation include rheumatoid nodules or from pump of tissue, and these most common in the skin around pressure points such as elbow. more rarely in the lungs and the heart and the sclera of eyes. There is also increased risk of atherosclerosis and therefore heart attack and stroke. There is also anemia, interstitial lungs fibrosis, pleural effusion, which can prevent as progressive shortness of breath. One particular serious condition that is associated with the rheumatoid arthritis is Felty syndrome, which is a triad. This one is a triad of rheumatoid arthritis: splenomegaly, granulocytopenia, rheumatoid arthritis. It can lead to life-threatening infection. Next one is diagnosis, usually involved in confirmation of blood test, like looking for that rheumatoid that factors and anti-citrullinated peptide antibody. By using blood test, usually investigated two things. One is rheumatoid factor and second one is anti-citrullinated peptide antibody. Then imaging studies such as X-ray usually revealed decreased bone density, soft tissue swelling, narrowing of the joint space and bone erosion. Finally, treatment, disease modification, anti-rheumatic medication. Drugs like methotrexate, hydroxychloroquine, and sulfasalazine. These drugs help to suppress inflammation. What are the three modified anti-rheumatic medication drugs? Methotrexate, hydroxychloroquine, and sulfasalazine. Rheumatoid arthritis இதில் வந்து மசில்லையும் ஸ்கெலிட்டன்லேயும் டுகெதராக இல்னஸை காஸ் பண்ணும். ஜாயிண்ட், ஸ்கின் அண்ட் லங்ஸை வந்து அஃபெக்ட் பண்ணும். ஹெல்த்தி ஜாயிண்ட் கவர்டு பை ஆர்டிகுலர் கார்டேஜ் அண்ட் ஆக்டஸ் எ ப்ரொடக்டிவ் குஷன். டூ போனையும் ஜாயிண்ட் பண்ணுறது. that fibrous joint capsule lined with the synovial membrane. The synovial membrane also have a blood vessels and lymphatic. Two factor, genetic and environmental factor, causes rheumatoid arthritis. That environmental factor causes modification of our antigen. Next, because of that susceptibility of HLA, D1 and D4 antigen, immune cell get confused. Okay, அப்போ வந்து நம்ம immune cell get confused by this change of antigen. So antigen picked by antigen presenting cell. So antigen picked by antigen here presenting cell is presented and carried to that lymph node, and T helper cell stimulate B cell, then proliferate and differentiate into plasma cell. Here what are the things? Antigen picked by antigen presenting cell and carried to lymph nodes. T helper cell stimulate B cell and proliferate and differentiate into plasma cell which produced specific auto antibody against this specific antigen. In rheumatoid arthritis condition, T helper cell and antibody enter circulation and reach to joints. ஸோ இந்த ஆன்டிபாடிலாம் இந்த ஜாயிண்ட்ஸ் ஹியர் ரீச் ஆகுது. T cell secreted cytokine like interferon gamma, interleukins 17 இதெல்லாம் வந்து 17 இதெல்லாம் வந்து இது செக்ரீட் பண்ணுது. ரெக்ரூட் மோர் மேக்ரோஃபாஜஸ். ஸோ டி செல் செக்ரீட் பண்ணுற சைட்டோகைன் இன்டர்ஃபெரான் காமாவும் இன்டர்லுக்கின் 17ம் என்ன பண்ணுதுன்னா அதிக அமௌண்ட்டாக மேக்ரோஃபாஜஸை ரெக்யூர் பண்ணுறது எங்கன்னா ஜாயிண்ட் ஃபேஸில். அது இன்க்ரீஸ்டு சைனோவியல் செல் அண்ட் இம்யூன் செல்ஸ் கிரியேட் பேனஸ். ஓவர் டைம் இட் காசஸ் டேமேஜ் லீட் டு போன் எரோடு. இங்கே வந்து அதிக அமௌண்ட்லாம் வந்து ஸ்வெல்லன் ஹேப்பன் ஆகிறதுனால இட் காசஸ் தட் போன் எரோடு. அது மட்டும் இல்லாமல் இன் அடிஷனாக தட் இன்ஃப்ளமேட்ரி சைட்டோகைன் இன்க்ரீசஸ் ப்ரோட்டீன் ஆன் த சர்ஃபேஸ் ஆஃப் டி செல். அதோட நேம் வந்து ரேங்கல். இங்கே வந்து ரேங்கலோட ரெசிப்டார் ப்ரெசண்ட் ஆகிருக்கு. இட் வில் ஆக்டிவேட் நியூக்ளியர் ஃபேக்டர் கப்பா பி லிகண்ட். ஆஃப்டர் என்ன ஆகுனா that rangle allow the T cell to bind rank the protein on the surface of osteoclast to get them to start breaking down bone. Meanwhile antibody also entered to that joint phase. Here antibody also here involved ஆகுது. So antibody is called rheumatoid factor, which is an IgM antibody that target to constant that Fc domain of altered IgG antibodies. So என்னென்ன பிளேஸில் என்னென்ன டிசீஸை காஸ் பண்ணுது, then what are the diagnosis method and treatment எல்லாமே இந்த இதில் ப்ரீஃபாக டிஸ்கஸ் பண்ணியிருக்கோம். தேங்க்ஸ் ஃபார் வாட்சிங்.